Good afternoon, everyone. I will be the moderator for this panel. Today we have a really distinguished panel here. And later we'll hear from our panelists about the benefits of the digital health technologies, the future of digital medicine, the challenges we are facing, and their prediction for the next major innovation and the impact of COVID-19 in digital health. Without further ado, I would like to start our section and let our each dear panelists give a quick introduction about themselves.
Thank you, Dr. Lee. I will jump in. I am Ben Frank. Again, pleasure to be with everyone this afternoon. I have over 30 years of healthcare experience serving as a hospital CEO, twice working for-profit, not-for-profit healthcare systems, working in academic medical centers, working domestically as well as internationally. And currently I serve as the CEO of 3AIM Partners. 3AIM Partners is a consulting firm that specializes in working with healthcare startups, providing thought leadership, senior advisor work, and we also work with investors, linking investors with healthcare startups. So really looking forward to the dialogue this afternoon.
Hi, I will go next actually. Can everybody hear me? Cool. Hi, I'm Prasun Mishra, and as Ella mentioned, thank you. As Ella mentioned, I lead American Association for Precision Medicine, and the goal of the organization is to accelerate precision medicine and transform patient health. Actually, we also have an innovation ecosystem where we incubate technologies and solutions. We seed them actually, and then to a certain level, and partner with investors that are that work with us to make those solutions, scale those solutions actually. So you're happy to be here, Ella, Oren, and team. Thank you very much, and yeah, looking forward to the discussion.
So Lutz, do you want to give us a little introduction of yourself?
Perfect, happy to do that. Thank you, Ella, for having me here, and hello to everybody in the in the digital space. I'm Lutz Finger, not Finger-y, like I'm just a finger, like the normal finger. So there was a misspelling, just like if you search for me, use the part of the body. That's the surest way to get me. I'm not a long-standing member in healthcare, actually. So I'm a data scientist. I have built my own company around data, serving governments and NGOs. Wrote a book about how to use data for products, helped then companies like LinkedIn and Snapchat to go public. I'm a faculty at Cornell, where I'm teaching a course about how to use data. And I'm working for Google, where I'm using data, EHR data, to help providers to improve their capabilities. Essentially, the idea of creating superhuman powers by artificial intelligence. So my whole life has not been like Dr. Frank with healthcare. My whole life has been in how do you use data to be effective, and that's what I'm doing at the moment in healthcare.
Wonderful. It's really a nice and also wonderful to have the panelists all coming with a very unique and also different, diverse background. So my first question is, what exactly is digital health, and why is digital health that important, and how could that be really used to solve all the healthcare problems?
Yeah, I think I can take this actually. So digital health has been very dear to my heart actually, and so a simple definition, and there's a complex definition. Simple definition is digital health is utilizing digital technologies to augment healthcare actually, and I think it goes hand in hand with the vision of precision medicine actually. So digital health is a convergence of digital technologies with health actually. So we want to keep people healthy. So and healthcare actually. So when people get sick, we want to treat them and to enhance the efficacy of healthcare delivery, to make the medicine more personalized or now precise actually. So I think that would be my definition. Yeah. Thank you.
Can I jump in and That was a great great entree into our panel. So I think if you look at what digital means, it probably, if you've heard one definition, you've heard one definition. It means many different things to many different people, how you interact in healthcare. But I look at it as how patients are connected to a machine that can provide better health, that can provide better access, that can really expedite the care journey for a patient and maybe even for providers. So I look at digital as the connecting points. If you look at analog versus digital, if we take a lot of the steps out and we make care much more accessible through digital platforms, it's that connection, I think, that is so meaningful that patients and providers are really going to start to latch onto, of what is digital healthcare, why is it important, and how do you advance it, how do you get a lot more trust in it. So I think it's augmenting, and it's the connection, it's the point where you can reduce the friction to provide better access on a patient's care journey.
I love it, what Ben said. There's not a lot to add to, just maybe as a reminder, the biggest use of fax machines is still in the healthcare system. And like, this is a huge friction point. And why is digital health so important? I mean, at the end, it just creates an ability for us to make it less frictional, as Ben said, to ask us to use that data to do better serving, to create more access, all of those things, which we saw in the media industry happening, right? But like in the media industry, it's like people picking up an iPhone, and that's a person, and start watching and reading news on that iPhone or whatever device you use. And that's for an individual, this is an easy step. And we all know that to digitize parts is actually way more complicated. And you saw this in this very early sense, like while people can pick up that phone, like for industries to actually change is difficult. Now here we're not talking about an industry, here we're talking about an ecosystem of several industries coming together, and to use, to drive digitalization. And you have loads of stuff which is awesome with digitalization: access, better prediction, less frictionless transactions, more freeing of resources, more enablement of a patient. I mean, you can go on and on. The sky seems to be the limit. The problem is it's an ecosystem. It's not like a phone you pick up. And therefore change is difficult. And therefore we still have fax machines, which then get digitalized, sent over as a digital point, and then get printed out and then put into a folder, right? That's our digital world of today.
So digital health, you can also say this in many ways, is actually really revolutionizing the healthcare and also the pharmaceutical sector as well. So my next question is, no matter whether you are an entrepreneur or investor or advisor, we all know this sector is very crowded. There are many players in the market. So how would it really know what type of digital health are the most trustworthy one? Or in other words, as an investor or advisor, what advice can you give to the startup in the sector, in the digital healthcare space, to differentiate themselves? Since you all come with a very different background, I think it will be really valuable to hear from your own unique insight.
I can start with this one. I would not look for the word digital. So whenever, I'm like either in my Cornell work where I'm supporting as well a lot of young entrepreneurs, as well as obviously when I'm looking at companies, the idea of digital AI, and let me slash on a couple of other hype terms to like plus health, sounds extremely attractive. But that's like, let's not be the hammer looking for a nail. Right? Let's rather figure out what is the problem statement we are solving. Is it detection of better medication? Is it supercharging clinical powers? Is it refining access to users? Is it reducing friction in the system? Is it reducing fraud? Is it like all of those are like good problems? There's a world out there of healthcare and it's working. People have different views of how effectively it's working, and digital can help there. But the question is, what is the problem statement? So I would, in that search for what is making a digital health company successful as well, how much do you have a problem statement and how much do you solve an actual real world problem?
It's a great point how you frame that, right? It's reducing friction, but what is the ultimate problem that you're trying to solve? And how can you bring that solution where clinicians and patients understand what that problem is? Then they start to buy in to the technology. So I think healthcare startups, to be really crisp and clear, to articulate a message to where it's understandable. Sometimes it may be really hard to understand, what problem are you trying to solve? And if you can articulate that, here's the problem, here's the answer, and then start working back. And we heard earlier about storytelling, right? I think storytelling is so powerful in startups on why is somebody passionate about starting a certain technology? What drove them? Was it a personal experience, family experience, et cetera? Then folks start to latch on to understand what that means, on how you can bring trust and the understanding of what that technology can do back to the digital definition. How can you enhance a care journey of a patient by building trust and talking about what the technology is going to do to ultimately improve somebody's care and move from treating to prevention? So again, I think it's the power of storytelling, but how do you go and you have somebody latch onto your idea and articulate it? And the more people who understand it, it's just a swelling effect. So that's where that I think trust comes in. It's ultimately affecting the outcome of a patient in a positive way on how you get somebody a lot more engaged in their healthcare, and that builds trust. And then, as we all know, if someone has a good experience, they tell many people, and it starts to really get much bigger, right? So I think it's storytelling, and it's what problem are you trying to solve, and being able to clearly articulate that from the technology standpoint.
I echo both comments actually, and I would just like to add that with AI solutions, actually, like you see that those solutions have to be at par with physicians actually. So you can see an example in diabetic retinopathy actually. It can be now measured by AI solutions at par with physicians, and similar is true for radiology, analyzing radiology reports actually. So I think it will be very easy to demonstrate that that the platform or app or a solution or a technology is trustworthy actually. But I think that's where what I believe is that ecosystem connect and working with physician and hospital systems and early on to trying out actually, that's the key actually. Sometimes entrepreneurs stay in their bubble actually, and they're trying to see that they're building the greatest solution, but when they come to physician, they realize that there is already a solution, or this doesn't fit in the quote unquote the traditional healthcare system actually. So I think that's so engaging with the ecosystem, I think it will be the key actually from the beginning, and building that trust actually.
Yeah, it's a really good point that a lot of a startup company actually not only in the digital or in this health tech or healthcare industry, but also in other industry, that after working the product or technology for a really long time, and they found out it's really have difficult time to commercialize their product. It's actually there is a big gap between what they providing and also what really the marketing need. So that actually is a perfect point. And so I have a follow-up question regarding now that we are talking about how those companies can truly shift from the technology side to really a real product that can be accepted or can really solve the real problem. So my next question is, right now a lot of issue for those the company in the sector is they have a hard time to find a way to sell their product or to commercialize their technology. Or Ben, you also mentioned about the physician and the patient is they have hard time to make or to find a physician who are willing to try or endorse the application or software. Part of the reason maybe because their product or their technology is not really the solution there, but also meanwhile they probably have also way too many competitors or the players in the sector. So what is advice or insight, what advice you want to give to the startups about this issue, and also if any of you could also comment what is really the best way if, for instance, this is a B2B models if they want to sell their product or to access a hospital, then what is really the best way to achieve that?
I'll jump in and start. I think really what I've seen that's been really successful is having that subject matter expert have a white coat, right? It's the power of the white coat, having a physician really take the lead, talk about the technology and talk about, back to storytelling, talk about how this technology impacts clinical care, how it can advance clinical care, how it can enhance clinical care, and show cases how this technology is able to get a patient either more engaged or link a clinician to a patient where they have a different type of relationship that's going to ultimately improve the care of that patient. So in previous experiences, the physicians can really jump in. We worked with a medical device company, and one of the physicians is a founder. And once that physician connects with clinicians in a healthcare system, it can go down a road very quickly. Sometimes if you have the business or the operators trying to explain the outcomes, it may get taken as it's a financial play versus a clinical or patient outcome play. So I think it's really important to have a physician or a provider take the lead on talking about the purpose of the technology. Back to Lutz's point, what problem are you trying to solve? And clinically have somebody articulate that very clearly and show case studies that this technology can reduce length of stay by 20%. This technology can reduce an ER visit. As we just heard, ER visits are really expensive in the previous talk. So how do you really get to the point where there's a better engagement and an absolute understanding of the betterment of clinical outcomes?
Can I only double down on this? This is it too. Healthcare has been, over the history of healthcare, and this is a long history, right? As humankind exists, we have healthcare. And there are many stupid mistakes which cost a lot of lives, where healthcare thought, this sounds logical, this should be helpful. And the healthcare community has taken on a very conservative approach, lucky for us, to introduce new technologies, new steps, which seems logical to be helpful. So nothing beats a clinical trial showing that what you do is actually helpful. So being clear, not only from the value proposition, but actually showing that it helps is important, right? I mean, take the lengths of stay. Ben, you mentioned lengths of stay. Like there are about, like from a data perspective, I once started to count like over 2,500 different research papers of how to predict lengths of stay. The question is, how do you get it into an action so that a hospital really reduces lengths of stay? Not only predicting it, but like how do you make it actionable and how do you actually deliver the value? So being clear on the value proposition, outlining a clear clinical trial to showcase that whatever you have envisioned, is it better detection? Is it like length of stay reduction? Is it better communication? Whatever it is really helpful, because if it's not helpful, like guys, we're trying to save lives, right? We're trying to help people. But then lastly, and this is special for the ecosystem which I made in the beginning, if it doesn't fit into the current ecosystem, And even if all the other things are there, it still might not work because there is an existing system of payers and providers and who work together, who have the current setup. And you're coming and have a great idea and it doesn't fit into any of those buckets, you actually will have a hard time because it's an ecosystem which is tightly knit. And I have seen several startups who came in, had a great idea, started to prove that it works, and failed then on that last part. And I've seen startups where the idea was, let's say, mediocre. They still could prove that it works, but they had a very clear value proposition for one of the players in that ecosystem.
Mm-hmm.
So
actually, yes, I do have a follow-up question, Lutz. You also mentioned about, let's say, data is also really important. And in many cases, it also becoming a really big differentiator for the same type of company. So it seems some company or startup, they just like they maybe like their team have, for instance, the CEO or the founder are the physician entrepreneurs. Therefore, they have their already natural access to already the hospital. And some companies, they probably just want to invite such a person as the advisor. But what generally, any advice you want to give to the companies regarding the data collection and also how to collect the clean data and also the accuracy, and also our other panelists, if you would like to chime in, you're welcome to also comment on that question.
Thanks, Ella. That's a wide question. So let's start something. My whole course at Cornell and my book, which I published with Orale Media, is actually structured around that data in itself is very often overvalued. I mean, like, what if you think about a linear regression, how many points do you need to decide two-dimensional linear regressions? Well, 2 data points, right? And if I give you 1 million points which are lying on that data, then this is big data, but doesn't necessarily mean it's helpful. So that's, for somebody who starts off, it's good news, because what you should really focus on is not necessarily like, do I have a lot of data, but do I have a clear value proposition? Can I prove the value in a clinical setting? And do I fit into the ecosystem, as I mentioned before, right? So the data itself is not necessarily like in some areas it is, but it's not necessarily the most important component for your startup.
Yeah, Dr. Mishra, sorry, you haven't really got a chance to
yeah,
share.
I think I would like to add on. So I would echo in the comments, actually, earlier comments, but I just wanted to add and kind of tell this little stories. So when entrepreneurs basically from the tech embark in healthcare, their vision is to transform healthcare, right? But I think we all have to understand that healthcare is very complex, actually, and we have to know the niche, as mentioned earlier, that we have the startup has to find a niche where it's where it's working and try to engage right folks to test it out, and then have healthcare systems, physicians as their partners, board members, actually from the beginning, actually. So, and we have also let's take life is very short to make all the mistakes. So learn from the the companies that have failed. Actually, I think one of the biggest examples is the failure of Heaven. Actually, right? I think there were 3 different reasons why Heaven failed. One was insufficient market power. Despite the companies had collectively had 1.2 million employees, Heaven they still didn't have enough power to lower the prices from providers. That was their first goal, actually. And basically perverse incentives, because our healthcare system is still run on run on reactive care. So basically, we are, majority of hospitals are still, get paid when their hospital beds are utilized. So I think these are some of the, and we still have the, reactive care, and then how do we transform to proactive care? I think Intermountain Healthcare, Kaiser Permanente has taken initiative to basically invest in value-based care, and others are following actually, and as well as poor timing, right? Timing is everything actually. So I think with having the COVID-19 pandemic actually has changed, providers' focus to manage the crisis and avoid the unnecessary hospital visits and unnecessary procedures. So I think these are some of the biggest lessons that we all can learn and see how we can apply in our own endeavors. Again, this is a very broad topic, right? But I think I thought to kind of add that to piece, to the discussion. Thank you.
Yeah, that is. Sorry, go ahead, Ben.
No, just excellent points just brought up. Again, we heard earlier about the shift from fee-for-service to value-based care. And that is a major shift. And if COVID has brought a lot of negatives, and it's brought some positives. It is forcing us to think and do things very differently. And when you're a fee-for-service healthcare system and you have to shut off elective procedures, that's devastating to a healthcare system. Now, as they shift to value, you have to think about who would want to be taken care of at home 5 years ago. It's going to be pretty common now for hospital at home care, which you're going to be seeing a lot more often, where this value-based equation, it's that bridge, it's that journey, like Intermountain Healthcare that you just mentioned. Health systems and providers are going to have to look at taking this journey much more seriously, and it's going to be a financial hit for a period of time. You've heard the term, there's a foot in two canoes, value-based and fee-for-service. You're going to have to choose at some point. And the more you go to value-based healthcare, you're going to start thinking about, to Lutz's point earlier, what problem are you trying to solve? And when you're trying to solve a problem on value-based healthcare, you think about care delivery much differently. So instead of trying to reduce length of stay, you're trying to prevent an ER visit. So you're going back on the spectrum a couple steps to find out how you can utilize this technology to think very differently and to do very differently and get buy-in from the clinicians. And you have a lot of decades of experience from the provider standpoint. So telling the story and articulating the points are going to be so critical to get the buy-in for the technology, for the platforms that are going to help you as a provider, as a health system, as a virtual type of provider, deliver that care in a different setting. So I think it's some great points, but the whole shift to value, and we heard very common points earlier about right place of care, right time, in the right hands. So it's something that we're going to have to embrace faster. And there's going to be a lot of companies, probably some that are listening to us right now, that are going to develop technologies that are going to be totally revolutionary, that are going to change the way care is delivered.
I would like to, if I may jump in, there is somebody from the attendees has asked a question, and I encourage everybody, like the panelists are here for you, so like make best use of that and ping us with questions. So, and there was a question, I'm a teenager focused on bringing healthcare education among younger minds. I'm more interested to understand your views or tips on how to use data or AI in our engagement. Especially end users are younger, bigger kids engaged in gamification products that hooks each other various use cases. Ben has mentioned a couple of times the problem of our healthcare system is that we are reactive. We, like, most money is spent on the sickest patients, and very little money is spent on the prevention. And you have several levels of prevention, right? You have the tertiary, like the primary prevention, and this is what your mom told you: eat better, sleep more, exercise more. That's what we call behavior change. And like look in the mirror, you all know that you sleep not enough and that you probably don't eat well, and you might be able to do more exercise. So that's one level of prevention. Then the second level is the secondary prevention. It's kind of like around you have been diagnosed with disease, and now it's a question: can you stop that disease from becoming worse, right? That's a secondary prevention. And then tertiary prevention is kind of like manage that the worst case scenarios. So we spend a lot of money in the third part, very little on the second part, and you will be scared to realize how much like effort we actually spend only on prevention in terms of screenings. The US is worse than Europe, but also Europe is not great. And then on the first part, the educational part of sleep more. I mean, there are studies who tell you, like, if you do sleep more, eat better, and do more exercise, you gain 10 years. Now, is that true or not? I mean, like, there's like a lot of debate around it, but it's good for you. So when you think about, okay, I'm trying to do healthcare education, one of the questions you need to ask yourself, where am I? Do I try to train a diabetic to not end up hypoglycemic? Do I try a pre-diabetic to get back to normal? Or do I try to teach somebody to not even get into the pre-diabetic stage? That is the value proposition you need to think of. Forget data, forget AI, forget engagement, forget gamification. What is the value you're bringing in that chain? Now, to all the discussions we had before, obviously, the further you go down, the more entrenched you are into the ecosystem, the more sides you need to pick in terms of being part of the ecosystem. Where is the money? The further you go upstream, the more you have access to consumers and have, like, you know, if you like the sleeping apps, which you can download from your favorite phone store, like, which tells you how to do breathing and how to fall asleep and how to track your sleep. That's an example. On the other hand, there are examples as well for, you know, like continuous glucose monitors and so on. I hope that helps.
Yes, yes, it's very helpful. Also, so actually today, many of us mentioned about also the gap or the difference between really, for instance, what a physician need, or what a really market need, and also what a startup are providing. So can you think of, for instance, what is, I'm curious to learn, what do you think the largest myth between those startup company and, for instance, either hospital setting or from physician's perspective, or from the market? What, to your experience, what is the most common case you see that have the biggest gap between the demand and also the providing?
I can jump in. I think it's the patient engagement. I think it's patient engagement. It's getting the patient a lot more engaged in their healthcare. And I think it starts with the educational piece. I think in healthcare, we can do a much better job on taking the time to educate patients on why they should be more engaged in their healthcare. Like the question that Lutz brought out, how can we engage teenagers more? How do we engage families? How do we engage caregivers more to be a lot more focused on that care journey, and to have that digital front door where, how do we make it as seamless as possible for a patient if they want to schedule an appointment, instead of picking up the phone in an analog type of situation, can they pick up their cell phone and schedule an appointment in about 15 to 20 seconds, right? So I think, how do we remove the barriers, and how do we create a way that a patient feels much more comfortable taking that step, getting engaged, trusting the digital platforms and technology to be more engaged? And sometimes it's okay to exchange an email or a MyChart message the provider instead of picking up the phone, calling the office. So I think it's really important for us to think about how we engage patients today and how can we engage patients much differently in the future to take that ownership step of going forward and saying, I'm going to take more control of my healthcare. Instead of going to the emergency room, I can schedule a virtual visit in about 20 seconds. So I think it takes time though. It takes that clinician or that provider that it's okay to do this. Sometimes it's that face-to-face. We're always in healthcare thinking it has to be face-to-face. And we heard that earlier where that's changing. So how do we let a patient and a family member know it's okay if it's virtual? You're going to get the same, if not better care because it's quicker. You may avoid some type of ER visit or some other type of health problem if you take that ownership and take that engagement and act faster.
Yeah, and I think I can add to Ben's, Ben's points. Actually, I think that to be precise, I think what I believe is there are a lot of opportunities in assisting, monotonous tasks, right? That physicians and hospital systems do. That's a big opportunity. AI chatbots, right? I think that can, like Ben mentioned, they can help physician patient interactions. When it's the hospital or after the patient is discharged from the hospital, right? We can also have, there's an also opportunity, big opportunity, and a lot of companies are utilizing to have virtual health, care assistants. Actually, that's one, I think very exciting opportunity, and also mining medical records. Right, medical records are, you saw that, Roche acquired Flatiron, for a really big sum. One thing they did is they just found a way to mine medical records, but there are opportunities. Actually, the system has not perfected itself there. And then treatment design, drug diagnostics combination, and together these are all will augment physician and patient interaction, because that's where we should be focusing on. That's basically core of the healthcare. I think so. How we can make that interaction more actually, and then aid with the technology. I think that's the vision. Thank you.
So, Lutz, do you have any?
I just read Doug's question, and I thought this is worthwhile putting this to this panel. The CMS and Medicare and some insurance carriers are paying for preventative care with several new billable CPT codes. As RPM CCM brings more value to the KPIs established, how would you use pop health data to accelerate getting more insurance carrier to reimburse? I thought this is an awesome question. I like Ben, Prasun. Do you want to take a first stab on it?
Sure, I absolutely. Again, great question. It gets back to what is the benefit of doing this, right? All the screening questions, getting patients more engaged upfront in their care. So the providers are going to look at this from the standpoint, if we can have somebody be more engaged in their care, could that mean that there's a reduction in premium down the road, right? And that's how we're looking at this now, instead of a fee-for-service world based on, let's just get a patient in and it's per click. How do we get a patient much more engaged where there's ownership for that patient and there's a return on that investment by investing much more in the screening technologies, so patients have that health coaches just mentioned earlier. So I think it's a great question. It's going to be a long journey, but with CMS and the providers looking to continue to reimburse for telemedicine visits, how do we really get the lobbying efforts to put a lot more emphasis and focus on prevention from the screening standpoint on how it's paid for? So I think that's a long journey. We're going to have to get there. And there are systems who are doing it, like we mentioned Intermountain, Kaiser, systems who invest, who say, this is the return. Our return is financial, but the bigger return is a better patient outcome. And then to convey the message, and then how do you get the payers to get a lot more engaged in those discussions and that investment, because it's a lot of investment in technology to do so, but we're nowhere near that as a healthcare system, and we should be.
And I echo Ben's comments. Thank you.
Lutz.
Yeah, and I think this was a perfect answer. Nothing to add to it. Maybe because David had and was following up with this and kind of saying, guys, this is cool. If the doctor only sees it for 5 minutes, how do you get it? Right?
But those are great questions. Yeah.
And I think the part here is, we all know this. We go to a doctor and the doctor gives us an advice and that's it. Doctors do not have a constant channel to us patients. The doctor who tells you, like you come and you have a terrible headache, you fear for the worst, you have read something about tumors. The doctor tells you, maybe it correlates with the drinking yesterday night, take a couple of ibuprofen and call me back if it hasn't stopped in 3 days. Now, you probably don't call back. Now, the doctor won't know, did it go away? Did you suffer more? Did something terrible happen to you? So this feedback loop, which we have in many other industries, is broken because the client-doctor relationship is in a traditional model broken, and Ben has outlined it perfectly, right? Intermountain, KP. There are many new models. Think about City Block Health, which is an Alphabet-funded company as well, which kind of work a lot with care coordinator to address this coordination issue and close that feedback loop.
Yeah. We only have 3 minutes left. I feel there's so much that need to be discussed. So let's use the last 1 minute for each of you. Any other thing you want to comment, for instance, any take-home message you want to give for the audience, or for instance, what do you think the most promising technologies moving forward? What could be the potential challenges, or any other advice you want to just give to our audience?
Yeah, I think I can start with. I think I'm not, allowed to comment on specific technologies and companies, but I will say that I'm really excited about artificial intelligence, blockchain to secure data, actually, and voice searches. Actually, I think we do this every day in our phones, right? And chatbots, actually, and virtual reality. Which VR has really in last couple of years has really taken off. The technology there are some limitations that we have to work on resolving that, actually. I think so. These are some of the most exciting areas that I think that appeal to me, actually. And I think I would just to the community, I would just put like a call for service, actually. I think let's work together to quadruple aim of the healthcare, actually. So there are 4, so improve patient experience, right? I think that should be everybody, all of our goal: improve patient experience, enhance patient health outcomes, and that is the core of the healthcare, right? And then number 4 is provide, improve provider caregiver experience. Actually, that's what we should be doing, actually, and reduce cost and focus on creating value. And I think so. This is a 4 pillars, actually, that together with the digital health as well as other interventions, I think we should, as a community, achieve. And also, I think what I believe is that I will leave you with physician burnout, actually. And we have made a healthcare so complex, actually, that it's physicians are really there are so physician burnout is a really big issue. So how we can come together and improve physicians and make physicians' life easy. I think that would be at a core in delivering the care to patients. Thank you very much. This has been a great panel.
Well said, very well said. From the engagement standpoint, I think it's really important. Let's put ourselves in the shoes of a patient. If we were a patient, what would we want differently? How do we articulate that? And the point just made, it's excellent. That whole patient experience is key. There's consumerism. Patients have choices. So if you're a healthcare system to a technology company, how do you create the stickiness where the patient becomes so used to using that technology, they don't think otherwise of going someplace else. So I think it's really important for us to maybe take a step back, put ourselves in the shoes of a patient, and what would we want our provider or our healthcare system to do differently to enhance the overall experience. And for all of the healthcare startups out there, keep testing the mettle of the system. Don't give up. Keep focused on bringing new ideas and keep testing the mettle. The healthcare system has to change. And young leaders are going to really propel that forward faster. So thank you. Great panel. Really enjoyed. It's an honor and a pleasure to be part of the panel. So thank you, Ella, for putting this together.
Sure, we will let Lutz have the last word.
Oh, that's a big burden. I actually would tell all the attendees only, guys, there is only one thing you need. Trust in yourself. There is tremendous opportunity. There is tremendous opportunity for change. And we are, as society, we just went through the pandemic and we realized that there's tremendous opportunity for change. Go and change the world for better. Thank you, guys. And thanks to the panel. This was awesome.
Wonderful. Thank you so much. Thank you so much for your great input. And also, I bet our panel, our audience will also find those talk extremely valuable. Again, thank you so much for making the time. Hope you also have a great day.
Thank you very much.